so that was a little better than when Dr. McPhee did it, but we are going to do this again. It's an amazing, it's a wonderful, it's a bright and sunny-ish Sunday morning, and we are in Tobago. So let's do that one more time right there. Good morning, everyone. Good morning. That sounds much better. That sounds like if you all are really happy to be here, and I know you are. Allow me to stand on the already established protocols and allow me to welcome the Trinidad and Tobago Medical Association's research conference to Tobago, and I did not recognize that this was the first time it has landed on the shores of Tobago. Welcome. Coming from a background of public health, most people don't recognize that my background is behavioral and community health sciences. After doing that's for my master's and doctoral degrees, and that came after I did a bachelor's of science degree in neuroscience. I am always elated, I'm always really excited when I see scientists and medical professionals doing this kind of work in Trinidad and Tobago. So give yourselves a round of applause. Of course, attending a medical research conference such as this not only resonates with us as professionals in the healthcare setting, but as human beings who understand the importance of having great cardiovascular health. The heart continues to be vulnerable and continues to be at the center of several diseases that plague us. Cardiovascular disease continues to be a leading cause of death and disability worldwide. And the same applies to Trinidad and Tobago. As a matter of fact, when you look at our statistics, we are close to almost 20% of deaths associated with cardiovascular diseases. I am sure that each of you, not just in your professional life, but I'm sure that each of you probably knows someone personally who is either coping with, recovering from, living with a cardiovascular disease, or unfortunately died from one. As clinicians and technocrats, looking at our theme, Heart Matters, I think we need to spend a little bit more time thinking about prevention. Of course, we've had the many advances in treatment and in care, but the fact is that heart disease is preventable, and it is preventable if we do some of the simplest basic lifestyle changes. You know, the eating healthy, you know, the getting up and walking around a little bit, you know, the ensuring that we are active throughout the day. But somehow these are simple little things that if we were able to treat with them, we would remove this disease. We can't get people to do. And I would encourage you all to have us think critically about what is preventing us as individuals, and what is preventing us as clinicians, and what is preventing us as clinicians speaking to our patients from being able to do the simple little things that we need to do. And I will use myself as an example. Having been in this position of Secretary of Health, Wellness the last 2.25 years being the most unhealthy person. I did not sleep well. The job dictates that you don't. I did not eat well. And I absolutely did not exercise. And then I got up one Sunday morning and I looked at a picture of myself and I thought, nah man feet. And I messaged someone who I knew very closely who was a gym instructor, and I messaged him and I said, I am not ready, but I must do this. I don't have the time, but I must do this. How much is it? Can we start tomorrow? He told me the figure, and I said, 9 o'clock tomorrow. I'll be there. Now I'm saying that to say this. 9 o'clock tomorrow means 9 o'clock on Monday morning. And the time that I usually go to the gym is between 8:30 and 10 a.m. during the week. I put on my gym clothes, I go directly to the gym, I get into my car, I drive to my office, I walk up the flight of stairs on the outside because I am still in my sweaty gym clothes. I slip in through the back door